Do you want to know the thing that everybody asks but we never talk about? It's price. And how much can you expect to pay for surgical treatments? Like, let's get into some of it, okay? So you can expect, first of all, that these are investments, right? You're not paying for something that you're just throwing your money into. This is an investment. It requires thinking about it and a long-term plan. The second is, remember, surgery is not a commodity, different results with different surgeons. It's not the same thing everywhere. And the last is you get what you pay for. So upper eyelids, first of all, or anything around the eyes. Upper eyelids specifically, I've seen as low as $3,000 and upwards of $20,000. The things that impact this are if you're getting ptosis repair for eyelids that come down, canthopexis to lift the corners of the eyes, if you're doing brow lifts, and then where you're located, where the surgeon is located, if they have their own surgery center, if they do in the office. Lots of things can dictate the price, but I've seen average probably $8,000 to $12,000. That's where things are going. Face and neck lift though is a whole nother beast. Now these surgeries can cost upwards of $100,000, $200,000, $300,000. And it depends again on what's included. On average, I see something around $20,000 to $50,000. May include a brow lift, fat transfer, lasers to give you the best possible result. But the top surgeons in the country, or the surgeons that are probably the most popular, are charging upwards of $100,000 because look, people will pay for it and they can stand by the results as well. And then rhinoplasty. Rhinoplasty, remember, is a very specialized procedure. It is not done just by anybody. It's primarily done by facial plastic surgeons or plastic surgeons that do a lot of rhinoplasty. And so that also can range quite a bit. I've seen rhinoplasties for $50,000, and a big thing matters is it a primary surgery or a revision? Have you had surgery on your nose before? Generally, the $20,000 to $25,000 range seems to be what most surgeons charge. But remember, it's all about where you are, the location, the downtime, how complicated your case is. And although price is an important and probably one of the most important factors, it's not the most important. You have to remember you have to get along with your surgeon because they're going to take care of you after. This is a team sport. It's not just one-on-one. You have to remember that you get what you pay for. Not necessarily that paying more will give you a better result, but paying low, a cheap rate, a discounted rate, there's probably a reason why things are discounted. Surgery should not be discounted. And also the results should be in your wheelhouse, should be in your liking. If you like the results of that surgeon, then it might be a good idea to go with them regardless of the price. Consider price, but consider the other things as well.